All right, so let's talk about leukemia. Um, don't stress about learning the classifications of leukemia this semester. You're going to get into that next year. So I want you to just focus on the patho, what actually is leukemia. What happens in leukemia, there's no tumor, but white blood cells that have neoplastic properties, remember what those look like. Remember that cancer cells multiply uncontrolled. They don't look like they're supposed to. They don't function like they're supposed to. Okay. There's unrestricted proliferation of immature white blood cells. So they have way too many white blood cells, but they don't have the ability to actually fight infection. Those neoplastic white blood cells infiltrate and replace healthy body tissues. They can infiltrate the spleen and the liver. They infiltrate the bone marrow, and they actually depress formation of the other formed elements. So they suppress formation of red blood cells and platelets, and then they're sending out all these immature white blood cells, but not any mature useful ones. So that patient is going to have anemia. They're going to get infections because they have leukopenia or not enough mature white blood cells, and they're going to have bleeding because of thrombocytopenia. Now, those cells keep proliferating and dividing. Remember that cancer cells don't respond to being close to other tissues by slowing down growth. They just keep dividing and dividing. So that puts pressure on the bones from the inside. It actually can invade the periosteum, and it can actually cause fractures. And so there's a lot of pain from that pressure, and it can actually cause fractures in the bones. Leukemia cells can invade the testes, kidneys, prostate, ovaries, GI tract, lungs, and the central nervous system. The diagnosis might be suspected based on symptoms, or maybe they have a CBC and the lab comes back suspicious for leukemia. The initial screening is done by blood smear. A smear will show immature white counts and low blood counts, but it has to be diagnosed by bone marrow aspiration or biopsy. Bone marrow aspiration is pretty painful. They also, once they're diagnosed with leukemia, they're also going to get a lumbar puncture to determine whether it's involved the central nervous system or not. So we're looking at lots of painful pokes before they even really figure out what's going on. It's managed by chemotherapy. There are 4 different phases of the chemotherapy. Induction, the chemotherapy is dosed to achieve remission. So it's to kill off all of the or as many of the abnormal cells as possible. Intensification, they continue chemo to eradicate any residual cells. And then they keep continuing it to prevent resistant cells. So they keep going with chemo to try to get every last cell. And then they do maintenance just in case to keep any from coming back. A patient who's at high risk for central nervous system involvement may get intrathecal chemotherapy prophylactically. After they relapse, they have to go through this process again, and the prognosis gets worse with each relapse. Okay, stem cell transplants are recommended. They can be curative, but remember how risky they are. So whether they're recommended during the first remission, which is when they first get rid of the cancer, get the disease into remission, depends on how likely that cancer is to return. Okay, so they're recommended the first time they're in remission from AML, but not ALL. You don't have to remember that specifically. I want you to understand why the decision is made that way. Okay, if it's likely to recur, they're more likely to recommend stem cell transplant when that patient is in remission. And remember, there's a lot of risk to stem cell transplants. Okay, next we'll talk about Hodgkin's lymphoma and non-Hodgkin lymphoma.